Welcome to Sex on the Floor podcast. This podcast was created to help educate the public about problems with sex and intimacy and how this is tied to both physical and mental aspects. Hosted by myself, Dr. Molly Hart, a passionate pelvic floor physical therapist and owner of Pelvic Balance Physical Therapy, and by Dr. Katie Schubert, a phenomenal sex therapist and owner of Cypress Wellness Center. We are here to have a good time. We're here to keep it real with you all and to educate along the way. I'm so excited for you to join us. We strive to help many relationships prosper in fun, safe, and healthy intimacy. While listening to the show, please remember that this information is not meant to diagnose or treat any medical conditions. Please speak with your medical provider for all things related to your healthcare.
Welcome to Sex on the Floor. This morning we are talking about the clitoris and all of the wonders associated with the clitoris. So to start, I'm just gonna throw out a few facts that people might not know about the clitoris, because what Molly and I have both found in our practice is that women are often either uneducated about the clitoris because nobody teaches us about the clitoris, or they're shameful about their clitoris. It's like a dirty little secret that nobody talks about.
Yeah, and like any type of stimulation of the clitoris or talking about a female orgasm. Yeah. Even in my office where that's like what we're there to focus on. It's like so hard sometimes to pull the questions out of people.
It is. Yeah. People don't know how to talk about it, but it's nobody's fault necessarily except for our societies because our society has historically shamed female sexuality. If you think back to like even the early 1900s, the term hysteria was given to women who it was a catch-all phrase.
Hysterical women. Yeah,
hysterical women, and the cure was going to the doctor and getting masturbated and having an orgasm, and then women would feel fine. But it was medicalized in that sense. And then it was,
I did not know they did that.
Yeah.
Okay.
So like there are these really amazing museums. Side note, there's a lot of amazing museums in the United States that focus on the history of sex or the history of sex toys, which will be our next episode, sex toys.
Yes.
And they have
precursor to that. We were going to talk about sex toys and we were like, we need to talk about the clitoris first.
Yeah. Yes, absolutely. But
the next one.
So historically, like in the early 1900s, hysteria was cured by providing a woman with an orgasm, then she'd go on her way and she'd be okay for a while, and then she'd get back into the doctors to have it done again. So the female orgasm has been a mystery to, well, I would say researchers, but nobody's thought to research it for quite a while because female sexuality has been unimportant, right? Like we know that we need the male orgasm to make babies. But nobody really thought about the significance of the female orgasm because it seemed unnecessary. Like there was no purpose to it. But with more research, they have found that the female orgasm actually does help with making babies, in that it contracts the vaginal walls and whatever. You'd be more versed in this.
We have the pelvic floor muscles start to go into a pulsation, just like it does for men. I've heard some funny theories from different philosophers about the female orgasm, and just some of them, I mean, they're not necessarily wrong in their thought process, but they make me mad because they're like, it's pointless. Like there's no reason for biologically for a woman to have an orgasm and and I'm just like, all right, and screw off. So here's my thoughts on the female orgasm. And I talk a lot about this with my patients. This is just, I don't know, this is just my ideology. The human brain is designed to always seek out pleasure. That's the way it's designed. And it's designed also to avoid any type of emotional, mental, physical pain. It's just simple design of the human brain. So really of a mammal's brain, like most animal brains are like this. So if women, I tell my patients all the time, like, every time you're sexually active with your partner, a lot of the women I'm working with are having pain with intercourse. I'm like, you have pain every time. And they're like, I don't know why I have no libido. And I'm like, you have no libido because every time you engage in something sexual, it hurts. And I'm like, that would happen with any activity or anything that you are trying to do if you had a negative response. So a big part of working with them is, yes, we're trying to get the pain down, but just because we get pain gone does not mean it goes to pleasure next. That does not happen. That's something that I had to understand after being in my career for probably a few years. You have to add pleasure with the sexual activity with a partner for then the brain to want to actually engage in that activity. So to me, I'm like, the clitoris is a vital part of adding pleasure. It's not the only thing that adds pleasure, but it's a vital part in adding pleasure to a sexual encounter. And then therefore the brain's going to want to do that again. Like, it's going to seek, I want to do this again, whether it's with a toy for masturbation or it's with your partner. But if every time you're with your partner, there's no pleasure, who is going to want to engage in the sexual activity with that partner?
Yes. And, like I was saying, women are not educated about their own clitoris. Men, are even less educated. So that's the whole point of us doing a talk about the clitoris, is to help spread some of that education, because if women don't understand their own bodies, not only can they not please themselves, but they can't tell their partner what they want. They can't tell their partner what feels good, where to touch, how long to touch. I mean, the clitoris, the best way to have a clitoral orgasm is through like consistent touch, not sporadic, not let's touch it for a little bit, go somewhere else, touch it for a little bit, go somewhere else, right? Like, it needs to be consistent.
Yeah. What were you were going to read off some facts?
Yeah, I was. So let's see. I had it pulled up here. Okay. So the thing that I think a lot of people don't know is and we'll talk about all of these things, but how big the clitoris is, how extensive it is. We see just the very tip of it, but and Molly's going to show some pictures for people who are watching this in a little bit. But the other thing, and it'll tie into the pictures that Molly's about to show, is how many nerve endings are present. So I guess let's talk about the extensivity of the clitoris. Go ahead, Molly.
Well, can you see this? You're seeing my screen right now, right?
I can see it. And if you are listening to this and not watching it, we will do our best to use our words to explain this picture.
So this is just the first picture I'm bringing up. I'm actually showing the penis and the clitoris, because what a lot of people don't realize is it's the exact same tissue, but the difference is really how it develops via testosterone is a main component of the changes that we see and the length of the tissue. But the clitoris is the bulb of the clitoris we see here. We've got the shaft, and then you've got these long little butterfly wings that come out. And I like to show this one. This is just like this outer vestibular tissue. Mm-hmm. And then this is showing more of, again, like an overlay of that clitoral tissue, where that's actually at on your body. So if you're able to look, you can see this is a little part, the glans clitoris that Katie was talking about. That's the only part we really think of or see. Then we've got this prepuce, which is the tissue that goes over it. That's really synonymous for like the foreskin over a male's penis, how it covers the head. But this actually can pull back. And when you pull that back, you can access the shaft right here, which is very sensitive. What a lot of people don't realize is, yes, this glans clitoris is probably the most sensitive spot, I would say, on most people, but this shaft right here is incredibly sensitive. And so when you are stimulating the clitoris, some of the most important areas to hit as far as the nerve sensitivity is going to be from the bulb up. So sometimes people will go from the bulb down, and that's fine. There's a little bit of tissue down here, but going from here up, like hitting this whole area, that's going to be the most important. And you can hit the sides of it as well. Like, you don't have to just stay on the front. And so I always educate my patients about playing around with their hands, with their partners, with different toys, of making sure you're really trying out all these different areas of the clitoral tissues and stimulating them and how it feels different. What do you like? Yeah, it's all different. It all feels different. Then there's different types of toys you can use. And so those are going to feel different. And so it's kind of fun. Just, I call it like a little playground of sensory exploration with your body.
This picture is highlighting, for those of you who are just listening, this picture is highlighting how much is happening under the surface. Mm-hmm. So we don't see it. If we just look down and look at our vulva, like, we don't see how large the clitoris actually is.
Yeah. And then when we talk about the clitoris too, externally, we're talking about this clitoral, the glans clitoris, but internally, vaginally, like you're still stimulating all of these tissues, and especially the top wall of the vagina, you're really hitting the backside of this clitoral tissue. And so that's why vaginal penetration for some women also adds like such an incredible amount of pleasure. And especially if you can even combine it, it depends. It really depends on how sensitive the female is. Like everyone's clitoris, the sensitivity levels, there's a vast array of, there's a huge spectrum of the sensitivity. Like I have some women I treat that are incredibly sensitive. And the bad thing about that actually is they tend to have more pain with intercourse. But they can easily, just a small amount of stimuli, like sometimes just stimulating the clitoris over the labia majora, and that's enough. Like they can't even use a vibrator, it's too much. Whereas you've got other women who need like an insane amount of stimulation to feel pleasure from this area. And women judge themselves with that, like if something's wrong. And it's not that something's wrong, it truly is just a different in sensitivity. Just like we all have different differences in sensitivity and like in every area of our body. So anyways, okay.
Molly, can you show the nerve ending picture? Because I think this is also another important thing, that you know, the clitoris has an insane amount of nerve endings. I've seen figures anywhere from like 8,000 nerve endings to 10,000 nerve endings. So just a lot of nerve.
This is a pretty general picture. I wouldn't say this is like specific to the clitoris, and I probably do have some of those, but I don't have those open right now. But this is just showing the pudendal nerve, which is the nerve that innervates our whole vulvar area. But then specifically, we've got this branch right here that comes up, and you'll see it says the dorsal branch of the pudendal nerve, and it comes up, and that's really what's innervating the clitoral tissues. But there's three main branches of this pudendal nerve. So there's that one, there's this perineal branch that comes down here, and then there's this inferior rectal branch that comes down here. And so as a pelvic floor PT, I'm always assessing which branch is affected, because oftentimes not all three branches are. People who are more significant and the severity of their pelvic dysfunction, all three of these branches will be affected. So it might start with just the perineal branch, and then now all of a sudden I have pain in the clitoris, or now I have like no sensation in the clitoris. It's because this branch is affected. And this is both motor, meaning nerves are sending down messages for this tissue to contract, to move. And it's also sensory. So it's pulling information, sensory information, and bringing it back to the brain.
Okay, interesting. So if someone comes in and says that their clitoris has lost sensitivity, the first thing in your head is this pudendal nerve. It's not something else?
First thing I'm thinking is that. And a lot of the times what I am going to be doing, the biggest time I see that happening, there's kind of two scenarios. One, which I see a lot, is a hypertonic pelvic floor. Everything is so restricted around there that the muscle can't even contract. And remember, we talked about an orgasm being that pulsing. And so they're just sitting in that intense hypertonic state. And so when you do that, nerves do not like that. Remember, we've talked about, I always say this, nerves like three things. They want a lot of blood flow. They want a lot of space and move around them, and they want to be able to move freely. So if I've got a really restricted tissue, because my autonomic nervous system is just ramped up in sympathetic mode, like I'm just go, 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 automatically, I'm not consciously doing this, that pelvic floor is just going to be on. It's like gripping. And so when you do that and you squeeze the life out of that nerve, it's going to stop working very well. Like it's not going to give you the function you want out of it. So that's one scenario. And those are my women who normally also have pain with intercourse. So vaginally having pain, and then all of a sudden a super lack of sensation in the clitoris. We see this a lot. And then my postpartum mamas, or women who have an insane amount of lengthening happening. So this can also happen. Third thing I should say is also hormonal. So we'll see this a lot in perimenopause and menopause, sensation go down. So that's a little bit more hormonal. But also what we're seeing with those women is a massive weakness in the muscles. So they have not, nobody's doing Kegels, and they might think they're doing Kegels, but they're not really training the muscle. So you have this tissue that's been traumatized maybe from birth, or there's a plethora of reasons. Maybe you had surgery. Well, you have to rehab it, or the sensation's not going to be there. Like after you have a knee surgery, you don't have normal sensation around the knee for a while. Like that's just normal, but we don't think about that for the clitoris. So all we have to do is just rehab the area. We do that with Kegels, we strength train. I do a lot of tissue work that I can teach them how to do as well. And then boom, the nerve starts being able to send messages down to tell the tissues what it wants it to do. And it starts sending up beautiful sensory input again. So those are kind of like the scenarios. And like I said before, as we start to see estrogen and progesterone go all over the place and decline during perimenopause, that absolutely affects orgasm function, and sensitivity.
Absolutely. Do you see anything else going wrong with the clitoris?
As far as sensation specifically or in general?
If people come in and they complain about like a loss of sensation in the clitoris or too much sensation, do you see anything else typically, like aside from the pudendal nerve or the
Oh, okay.
postnatal
I mean,
stuff?
the pudendal nerve is a peripheral nerve, but it does have spinal nerve roots. So there can be stuff going on in the low back, SI joint area that's causing not, but that's the thing is it won't just be the pudendal nerve. They'll also have other areas of the body that we're seeing an effect on. So like they'll probably have low back pain, SI joint pain. They might have some weird nerve pain or altered sensation going down the legs. So if I'm seeing a pattern of that, a lot of times when people are coming in, I'm screening the low back, I'm screening the SI joint, I'm screening the hip, what's going on with the hip joint. I'm screening a lot of those peripheral nerves that are running down, and I'm trying to figure out what tissues are involved. Where is this? What's the root cause? Where is this coming from?
Yeah. Okay, that makes sense.
So if somebody has some hip pathology, like a torn labrum, or yeah, like that could also affect the area.
That's so interesting. Everything is so connected.
Yeah, yeah.
So I think, I think the biggest message that we want to send our viewers, whoever's listening also, is that it's okay to talk to your partner about your clitoris. It's okay to, get educational. Have your partner look at your clitoris, have your partner look at your vulva, show them around, get them familiar with the landscape. Talk to them about what you like. Talk to them about where to touch you that feels good. As Molly said, we're all built differently and sensations are all different. And what's pleasurable for one person might not be pleasurable for another. So it's really important to get educational about what feels good. I often refer my clients to this educational platform. Molly, I don't know if you've heard of it. It's called OMGyes.
Oh yeah, I love OMGyes. Yeah. But I will say OMGyes, what I love about it is a form of graded exposure, because women who are really like afraid of even looking at the vagina and the vulvar tissues, it can be a lot.
Yes.
Yeah.
I
love it though.
It's very educational and very interesting, and it gives you a lot of ideas and a lot of words to put to, sensations, body parts, and all of the things. Another resource that's fantastic is the Come As You Are. Do you recommend that to your patients?
Yeah. But you want to know what's crazy? Katie, I still haven't read that book.
Oh, you haven't?
No. And I know about it, and I know the cliff notes on it. But I still haven't read the book. I have it. I have so many books I need to read, but all the time I have.
I know, right? I was telling someone the other day that I literally have a stack of books that I want to read as soon as I get the time, but it's been like 6 years and I'm like, I don't know if I'm going to have the time.
What I'm really trying to cultivate, and I have done this in the past, is just a really good habit of reading a certain amount of pages. And then it'll be fine. I'll get stuff done, but it just, it happens, and then life happens and I get out of my habits. So, but back to the clitoris, I think, and you correct me if I don't know what you do in your practice when you're working with women who really haven't explored their clitoris much. And again, the reason why I feel like the clitoris is so important is because if you are able to learn how to give yourself pleasure as a woman, like how to stimulate your own body that you're given, you're going to naturally feel closer to your own sexuality. You're going to naturally feel libido increase. And you're going to want to be more active with your partner if this is a problem that you're encountering. Like maybe you just want to be more sexually active with yourself. I don't know. Maybe it's because you don't desire your partner. That's something that you personally have to work on and allowing for pleasure, so that way you'll want to engage in this. And so if you and your partner are not focused on your pleasure, like you're never then both people lose. Both people lose, because then you're not going to want to engage. It's going to feel like a chore to do anything sexual with your partner, but it doesn't have to be that way. Like it can be like the most fun freaking thing ever if the focus is viewing your bodies each like this fun little playground where we're going to like push here and tickle here and do that. And let's see what happens. And how does this feel? That makes partnered sexual activity, really awesome physical touch and really awesome quality time together. And I think I was listening to, what's her name? Esther Patel.
Wow.
I freaking love her. She was saying in one of the videos I was watching recently, like men care more about quantity of sex, like how often, and women care more about the quality of sex. And I know I can identify with that at least. But men aren't going to get quantity if you have no quality.
That's so true.
So I'm like, let's ramp up the quality and we all win.
So one thing I hear a lot from especially my heterosexual couples is women feeling like they can't incorporate like toys into their partnered sex because they feel, and society has taught this to us. So I am not putting the blame on men or women here. I am just saying that our society is so weird about sexuality. Like we're so shameful, we're so ick, we're so just not healthy about how we talk about sexuality and how we make people feel about their own sexuality. So women often feel, and again, I'm prefacing this about like heterosexual sex.
Yeah.
Women often feel like penetrative sex should be enough. Like they that's all they need. They shouldn't need anything else. And when they can't and don't orgasm during penetrative sex, they feel like something's wrong with them. Like, I can't orgasm. And I'm like, well, can you orgasm on your own with a toy? And they're like, well, yeah, of course. But I want to be able to orgasm during penetrative sex. And I'm just like,
that's a lie. I'm sorry, but that's a big, big lie. And I have so many women who are like, well, I can't. And they say it shamefully when they're like, but I can't orgasm with sex. And I'm like, yeah, most women can't. And I'm like, some women tell me they can. I was like, and I'm like, good for you. But I will tell you, that's a rare thing that I have women that I have talked to in my office, so in my clinical setting, that can orgasm with just vaginal penetration. And I would love to see like what studies have been done on this to really truly prove that. Do we know? Like, do you know how many women actually really orgasm with just vaginal penetration?
I'm not sure. I do know that the research about female sexuality is like disgustingly behind. Like we know a ton about male sexuality and the penis and erections and all the things. But when it comes to female sexuality, like nobody's really cared about it up until the last few decades.
Yeah, I'm so stupid because I'm like, man, if you would have cared about this, you guys would all be having a lot more sex. I mean, like you're just screwing yourself over.
Well, I think the way to do it is that we, as a society, again, I'm not blaming men, but as a society, it's just been very patriarchal in nature. Like we've been concerned about the male sexual experience and male orgasms because we've thought that was the important thing.
Yeah,
right.
That was like a woman's, I mean, even still now, that's still like a role in women's mind is like my job as the woman in this heterosexual relationship is to sexually please my male. I mean, it is. I still see it, and it's fine. I don't love it because I'm like, yes, and this job is also to please your body too. And so I'm like, it's not just about him. Like, let's stop hyper focusing on him and let's focus on each other, and both people can reciprocate. And honestly, a lot of men, not all, a lot of men, they love to please their women. They want to know how to please you, but they're sometimes stupid and don't know how to. So like, that's where it comes in for us to learn about our own bodies and to be able to teach our male partners to be able to openly talk about and communicate, which can be hard for people. And that's where I hope that, I don't know, you're willing to work with somebody to help you, like somebody like Katie, or if there's an online course, like something to help you guys have these conversations to allow for more pleasure together.
Yeah. What I tell a lot of people starting off, and this goes for any couple of any sexual orientation, is if a couple is disconnected, the thing to do initially is to approach sexual interactions selfishly. And that's a novel thought for especially a lot of women, like, oh, I can be selfish about this. But like, if you approach a sexual encounter and you are being selfish and your partner has been given the same instructions, the onus is on them to get their pleasure, right? So like, you need to communicate, this feels good, keep doing this, right? Or oh, that doesn't feel good, move along. But you're not hyper fixated or worried about pleasing your partner. You're only worried about pleasing yourself. And given those instructions initially on that sexual journey really does help you tap into your own sensations and help you communicate to your partner. So I give you permission, anybody who's listening, talk to your partner, say, we're going to have sex tonight and we're both going to be so selfish about it, and see how it goes. See whether or not it's easier for you to get pleasure from it, to communicate with your partner about what you like.
I love that. I mean, I love that because that's how I hope that all of you guys start to continue to do that in your and sexual intimacy moments with your partner, because you'll actually find it just being way more fun.
Yeah.
Last thing that I think is an important, like, fun little thing to experiment is, if you are a woman who does know how to please yourself, you're listening, you're like, oh, I know how to have an orgasm by myself. I struggle to do it with my partner. Or a lot of women will tell me, like, I don't like to use a vibrator with sex. Like, it's like awkward. I can't get it in the right spot. Okay, that's fine. But what I don't know where we came up with this rule that, like, we have to have an orgasm during sex. Throw that rule out the door. And I tell a lot of the women I'm working with them, like, these are women who already know how to use a vibrator well. They can already achieve an orgasm well, and they enjoy doing that. So when they have a higher libido, they're not going and having sex with their partner. They're going by themselves to masturbate. I'm like, cool. I like that. So take that into the bedroom. I'm like, are you willing to use your toy on yourself in front of your partner? But with the stipulation that then they're pleasing you in other areas that you have probably yet to explore. So, like, what does it feel like to use your toy and masturbate with your eyes closed, selfishly focused on yourself, but your partner is making out with you, or your partner's kissing your neck, or maybe you like dirty talk and maybe he's whispering different things in your ear. Maybe he sucks at dirty talk and you need to say, hey, can you go learn how to do dirty talk better? Like whatever it is, the fun things that you know that turn you on, have your partner doing that while you're doing your own little thing that you already have practiced. Your clitoris already knows how to orgasm and have pleasure like that. But how can we add your partner into that already established habit? And I'm like, that can be done before sex. And it can also be done after sex. Like, you can have sex and then afterwards, now it's all about you. So he had his orgasm. Awesome. Now let's focus on her pleasure. All of the above can happen. We can have an orgasm before, during, or after, when the penis is in the vagina.
Right. Yeah, there's no right or wrong way to do it. Like, so long as you're content with your own pleasure, go for it. Like, there's no script. Just, yeah. But what Molly said, try to erase everything that you think you know about what you should and shouldn't be doing during sex.
Yeah, the rules that heterosexuals give ourselves about, like, what sex is. Like, where did this come from?
Yeah. I mean, it's just we're undoing a lot of history here, which is wonderful, but also very time consuming, because there is a tremendous amount of ick history around female sexuality.
Yeah.
Female orgasm. My cat.
And okay, last thing is to, like, even now in modern movies, like brand new movies that come out, shows that come out, they have sex scenes, and every time I get so mad because I'm like, these are so unrealistic. Last thing was just, you see, though, like, no lubrication, nothing is happening, like penis just goes straight in, and then, like, literally 10 seconds and the woman's like, oh, I'm having an orgasm. And I'm like, this is not realistic. I'm like, what are we doing right now? And this is still perpetuated in Hollywood. So please, please, please don't use porn as an example of what is normal for female pleasure. Please don't use the movies, girls and women listening, and men, not realistic. Anyways, that's my point, is just, like, we're still not even portraying sex right in society still today, 2024. So I'm like, we've got a long way to go.
Oh my God, we do. Yeah. But that's, what we're doing, you and me.
Yeah.
By ourselves.
There's other people out there doing it, and I love it. All right, any last things you want to add?
I don't think so. I think we're good. I think we're so in the next show that we do, we're going to be talking about sex toys, and how they can stimulate the clitoris in different ways. But I think we'll also be talking about the few male sex toys that are out there and what they can do.
Okay, I love it. We can do that. I've got some fun ideas for episodes coming up here soon. So thanks for listening, guys. We will see you at the next episode. Bye. We are Dr. Molly Hart and Dr. Katie Schubert, and you've been listening to Sex on the Floor podcast. We really hope that you enjoyed this episode. If you have any questions and want to get in contact with us, you can follow us on Instagram at Dr. Molly Hart and at Dr. Katie Schubert, on Facebook at Pelvic Balance PT and at Dr. Katie Schubert. And for more information about us on our websites, you can find us at pelvicbalancept.com and at drkatieschubert.com.